today we're going to be going over kind of what you can expect that first week or two after getting a Lipo 360 with fat graft into the butt, or the BBL procedure as most people know it by. So this is one of the procedures I always educate patients. What I'm able to do in the operating room is about 50% of what your final result is going to be. That other 50% of what your final result is going to be really depends on how you treat the post-operative period, following all the instructions that we give you, and really doing your best to follow those rules that we have set in place. It's not to give you a hard time, it's to get you the best possible result. And so we're going to kind of break down each day in that first week or two to kind of get a good sense of what you should be doing. So surgery day, big day. A lot of things have changed with your body in those few hours you're back in the operating room with me. You're going home, you're a little groggy from the anesthesia, you're uncomfortable from some discomfort related to the pain. The first day, it's really all about just staying off of your butt, staying on your stomach, or standing up and walking around. We want to decrease that risk of blood clots that can form in your legs and go to your lungs. And the best thing we can do to decrease that risk is to get you up walking around the day of surgery. So that's really important. The second thing is to really prioritize staying hydrated. We removed a lot of fat, and then in those spaces that we've created by removing that fat, your fluids shift from out of your blood vessels into those different spaces, and so it's imperative that you stay well hydrated. You really want to aim to drink at least a gallon of fluids every day for that first week after your BBL. And this can be mixed with electrolytes. It can contain sugar, so things like Gatorade or vitamin water. Anything that's going to help you stay really hydrated is really important to do. It's important to eat eventually, but that's not as big a worry for the first day or two after surgery. You just want to prioritize taking small amounts of fluid continuously throughout the day so you're staying well hydrated. We do everything in our power to decrease your blood loss. We use our tools like Vaser, if that's what you got. We use Cell Saver. We do everything so that we're maintaining as much of your own blood as possible. But you still really need to focus on that hydration so you don't start feeling faint or dizzy after your surgery. So when we send our patients home, we don't send you home in a faja for the first day. That gives your body a little chance to rest and recover. It also helps us identify if there's any worrisome areas on the skin that we need to be keeping a closer eye on, or we don't want to put a lot of pressure on. So your first day, you don't go home in a faja like a lot of different clinics do. You're going to go home without a faja, and then you're going to send us pictures, and we're going to do a video call with you the first day after surgery to make sure your skin is looking good. And then we're going to give you the green light to start wearing your faja, your stage 1 faja, your low compression faja. The other thing you really need to do is start scheduling your lymphatic massages and getting them post-op day 1. Ideally the minimum of what we want is a minimum of 20 lymphatic massages. And the breakdown of that is usually you want to get your first 10 massages almost daily during the recovery process. So for the first 10 days, almost daily, you're getting a lymphatic massage. This is going to help get out all the swelling. It's going to help your skin contract. That in combination with wearing your faja is going to really it's going to be what helps your skin retract so you get a beautiful result. And then you're also going to need to be prioritizing staying off of your butt. So we just grafted this fat. We disconnected it from its native blood supply. We put it somewhere else in your body, and your body needs to reattach a blood supply to that. So the pressure of sitting down, even for a few minutes, can really decrease the yield of fat that you're going to get long term. So we always expect about a 60 or 70% long-term maintenance of the fat that we transfer, because we just know some of it's not going to make it. But if you do things like sit on it or put pressure on it, that's really going to decrease the yield, and you're not going to be happy with your results, or you're going to have flat spots or something like that. So we talked about getting up, walking around, staying hydrated, getting your lymphatic massages, wearing your fajas. In combination with your fajas, we usually start wearing foams, and so those foams can help decrease the creasing that the fajas can cause. And then for patients that are getting more high definition liposuction, where we're really carving out some deeper areas to give you more definition of your ab muscles, I hear a celebration going on in the background. We're celebrating a birthday here. So for patients that have high definition, you'll want to use foams for those areas as well, because it's going to help get those depressed areas to really stay down and give you that definition you're looking for. So this is a little breakdown of kind of what to expect and what you can do to help maximize your results for that first week after your BBL surgery. And I'm going to open it up to any questions. We also have some questions from last week that we forgot to get to. So we'll go through some of those as well. But do we have any questions right now?
Yes. How long do I need to get off work?
So it depends on what you do for work. I always tell people you really want to shoot for taking 2 to 3 weeks off from work. Possibly longer if your work involves any type of manual labor. If you have, a desk job, you can't be sitting at your desk after a BBL, but you can be standing at a desk or laying down on your stomach. And most people can return to a desk type job within 2 weeks. Some people need that extra week to recover, but again, it's a busy time because you're getting lymphatic massages almost every day, so you need to account for that with your schedule. But if you're working a desk type job, 2 weeks is about the time most people can go back to work after a BBL. If you work a more manual labor type job, you want to take at least 6 weeks off.
Perfect. Why aren't cosmetic surgeries like a nose job covered by insurance?
Because it's not medically necessary. So, and that's a really tough question because there's a lot of things that I feel probably should be medically necessary, or that it's a deformity that someone is really struggling with or having a body dysmorphic disorder because of different things. But it's hard to draw that line, and unfortunately I'm not in charge of insurance companies, so yeah, it's a bummer that they don't cover cosmetic surgeries, but for the most part they do not.
There is another insurance question. Somebody said small bowel is pushing through. Will insurance cover a tummy tuck with this issue?
So that sounds like you have a hernia, and typically no, they're not going to cover a tummy tuck to treat a hernia because there's different ways of treating that, either directly with a small incision over the hernia and placing a mesh, or doing a laparoscopic hernia repair where you place a mesh from underneath. The only times insurance can cover tummy tuck type procedures is if you have massive weight loss and you have hanging skin that's irritating your skin. Sometimes insurance covers that. And then for certain types of breast reconstruction, it's really not a tummy tuck, but we're using abdominal tissue, and it gets rid of, or it moves some of that tissue to your breast for cancer reconstruction.
Somebody says, why is BBL considered dangerous?
So BBL got a bad reputation from people that did not understand the anatomy doing this procedure. And so it can be very dangerous if you're injecting fat into the muscle. There's some big veins called your gluteal veins that supply your butt muscles. And if you're injecting fat into the muscles, this fat can migrate into those veins and cause what we call a fat embolism. This is very dangerous and it's hard to treat. But we have totally adjusted how we do BBLs, and we, first of all, never intend to inject fat in that muscle layer down there. And it's a little funny because different parts of our body, we do inject fat into muscles, but for BBLs, those gluteal veins have been the culprit of this dangerous aspect of the procedure. So one, understanding your anatomy, going to a surgeon that does a lot of these, and three, probably most importantly, is using ultrasound guidance over those sensitive areas to create that space that's above the muscle and below the skin, and you can confirm that you're in the right place with direct visualization of the ultrasound. And with all those tools combined, it's actually a very safe procedure, and safer than some of the other plastic surgery procedures we do.
Somebody asked, what do you suggest for cellulitis on the butt and the thigh area? Lots of cottage cheese skin.
So this is very important to distinguish what the problem is, because cellulite is something that Anybody can have kind of at any different age, but usually when you've gained weight, it tends to be a little bit more pronounced. And it's actually caused by a tethering of the superficial skin to deeper structures. And we have a great tool for treating cellulite, and that's called Abilene. And it's a minimally invasive tool that you don't even need to be under general anesthesia. We can do it right here in the clinic. And we can go in there and cut those little bands that's causing the skin to pucker down. But you need to make sure that this is not due to skin laxity. So a lot of people, especially our massive weight loss patients, they have cottage cheese all over their butt and their lateral thighs. They would really benefit from a lower body lift or a circumferential body lift, where you can kind of just look in the mirror and see if you pull up on it, does the cellulitis go away completely? It may be a skin laxity problem, and the best treatment for you may be doing a circumferential body lift rather than anything targeting those areas. But if you're a younger patient and you have a few just definitive areas that are always puckered in, it's probably cellulitis, and we have a great treatment for that now.
I had a tummy tuck all around. Can you fix the buttocks deformity?
It depends what that buttocks deformity is, but there are things we can do for that. Oftentimes when we're doing that circumferential body lift, she's describing something similar to what I was just talking about. You end up with a flat butt because you've lost a lot of volume there from massive weight loss to begin with. So if you have donor sites for fat, we can try doing a fat transfer. When I do these procedures, I like to do an auto augmentation or use some of your own tissue that we take the top layer of skin off of, but then tuck some of that fat and dermis down into the pocket to give you more shape to the butt. So it depends on the patient, but we have different things to improve your buttock if you had a circumferential lift, especially if it's because of lack of volume now.
There's a lot of questions today. How long after breastfeeding can you get breast implants?
Bare minimum after your breast milk has completely dried up, 6 months. I prefer patients to wait closer to a year if it's possible. You also want to give your breast a chance to kind of recover from breastfeeding, because your skin's going to retract a certain amount, and we want to make sure you're at a good baseline before we do it. But if you put in implants too early, or you do any type of breast surgery too early after breastfeeding, you can end up with a milk cyst that we need to treat with medication. So it's best to wait for everything to dry up a minimum of 6 months.
How do you feel about rib remodeling?
This is a hot topic. This has changed a little bit from what we used to talk about doing. You know, they used to do actually removal of ribs to improve the contour of someone's abdomen to give them more of that hourglass shape. And I was always pretty wary of that procedure. It seemed like quite a bit of morbidity and risk for what level of reward you're getting for it. But now we're actually doing remodeling, meaning we're actually doing a very controlled, directed fracture of ribs through small incisions, and then binding them down and just reshaping how they're going to heal during that healing process. And I have not personally started doing this procedure yet, but I am interested in potentially picking that up pretty soon, because the latest literature and the latest technique and how they're doing it is promising. And that's a really difficult problem to treat for some men or women out there, whoever's looking for it, because we can't change up until we have these procedures. We can't really change how your ribs are. And so if you had a very boxy chest that poked out, we just didn't have great options, even with tummy tucks and liposuction and everything else. So it's a good option to have, as long as it's done safely by a well-trained person that's done a lot of these and gotten the proper training for it.
Do you recommend cavitation after tummy tuck? If so, how long after the tummy tuck should we start?
So there's quite a few different treatments that people talk about during recovery from surgery. There's red light therapy, there's ultrasound therapy, there's cavitation therapy. I don't think there's great literature supporting any one more than the other. I don't think there's anything bad about trying it. I want you to definitely heal for a while first. You know, the thought process is that it breaks up scar tissue. So I want you waiting at least 3 or 4 weeks before doing something like that. But the things that I know help and work are wearing your fajas and getting lymphatic massages, and that should be started right after surgery.
Okay, last question here, and then we can answer these. Do you get loose skin after liposuction?
You can. That's why patient selection is super important for liposuction procedures. We want to make sure you're a good candidate for the procedure and that your skin has enough elasticity that it's going to retract. And so it's one of the important parts of choosing a surgeon and going through the consultation process so you know that you're choosing the right surgery for you.
Great. So now the questions from last week. Do you use the internal mesh for breast lifts?
Yes, so Galaflex mesh. I don't use it for all of my breast lifts, but for any patient that's had massive weight loss or they've had issues with implants bottoming out in the past, it's an awesome tool and it's very helpful. I did a case this week with it. So yes, I do use it, but not for everybody.
Amazing. When does the swelling go down and when do you see the final results of a tummy tuck?
All right, so this is always something that we need to educate our patients on. The majority of your swelling is going to be away by the 2-month mark, but you'll notice at the end of the day, you'll still see swelling in your lower abdomen. When we make that long incision down in your bikini line, we've cut through all your lymphatic ducts. And those take a long time to heal. So it's actually up to 1 year before you see your final results and you're not retaining fluid in your lower abdomen at the end of the day. So 2 months, the majority of the swelling's gone and you're seeing your ideal result for the most part, but you'll notice at the end of the day swelling, that goes away completely at 1 year.
Why do breast lifts look flat at the bottom?
So the main reason breast lifts or breast reductions look flat or boxy at the bottom is because we haven't waited long enough to take our follow-up pictures. Just like all these procedures, like the tummy tuck, it takes time for things to settle and heal completely. And so most of the time when you're seeing that, we've taken these pictures at a post-op appointment at 2 months, 3 months, and they haven't had a chance to relax and settle the rest of the way. At 1 year, they're typically nice and round at the bottom.
Do breast lifts have drains post-op?
I typically never use drains for any of my breast procedures. There's been a few rare instances with capsulectomies or something like that, or implant removals that I've done it, but for the most part, no drains for breast procedures.
What are your thoughts on lipofoam? Is it necessary and why or why not?
Yeah, as we talked about, it is necessary in targeted areas. It decreases the creasing that can be caused by fajas, and it can help give you more definition when you're doing high definition liposuction.
Will muscle repair diastasis recti be part of the tummy tuck procedure?
Yeah, so pretty much always diastasis repair or muscle repair is going to be done with any tummy tuck. Few exceptions might be mini tummy tucks where we're not elevating all the way up or cutting around the belly button, or reverse tummy tucks where we're making the incision underneath the breast, is then we don't tunnel all the way down to do that muscle repair. But for a standard tummy tuck or a drainless tummy tuck, you're definitely getting a muscle repair.
Okay. Somebody says, are arnica pills okay to reduce bruises after surgery, and can they be taken before surgery to help possible bruising?
Yes, it can help, but just like all supplements, these types of pills are not very well regulated. So I don't know what is in your arnica pill, and so for that reason, I don't like any of my patients taking them 2 weeks before surgery or 1 week after surgery, because different supplements can have certain vitamins or other things that can increase your bleeding risk. So it's okay, you can take it, but I want you waiting at least a week after surgery before starting.
Somebody said, where are you located and the cost of chin liposuction?
We're in Miami, Florida. I don't have the cost. You can check us out at pureplasticsurgery.com, fill out the consultation, but it's a few $1,000 for just one area of chin liposuction. All right, everybody, thank you for tuning in. I hope you all have a great weekend, Mother's Day weekend this weekend. Celebrate your mothers, your wives, your daughters, anybody who's going to be future mothers out there. Thank you all. Have a great day. I will see you next week.